Namaskar, I am Dr. Anurag Bajpai, Pediatric and Adolescent Endocrinologist and Diabetes Specialist. The entire world is now in the grip of the coronavirus and COVID-19 pandemic. All of us, we the healthcare providers, the parents and children and adolescents with diabetes are worried as to how it is going to impact their lives. So today we'll discuss briefly about how we can improve the lives of children with diabetes during these troublesome times. We all know that COVID-19 has really changed the way we live. We have seen changes in terms of how we interact, how we go out, and how each and every part of the world is affected by this pandemic. World really is in a lockdown, and we are probably facing the biggest challenges of our lives. And this all has been caused by a very small microbe, which is virus. Virus basically are one of the smallest pathogens who would not be able to survive outside the human body. Once they get into the body, they use our own replicatory technology, so to speak, the way of using our own material to produce, reproduce, and then cause more harms. Viruses have been there throughout history, and there have been numerous cases in which virus-related illnesses have caused havoc for humanity. One of the more significant of these have been the coronavirus, which have been associated with a number of animal infections as well as human infections, and many of the earlier pandemics in the form of SARS, which is a sudden severe acute respiratory syndrome, the MERS, they were all related to this virus. And now we are faced with a novel coronavirus. The problem here is that we don't have any immunity, the power to fight this infection, because all the other infections throughout ages we've either acquired that immunity or we have specific vaccines which prevent us from getting infected from that. Since it's something entirely new, our body has never been exposed to it, there are no defense mechanism. Therefore, this virus has a very high chance of infecting us. And when we say infecting, we can have a wide variety of clinical features, which can be like any simple upper respiratory tract infection or cough or coryza that we have, running of nose, sneezing, low-grade fever, that will be the mildest form of the disease. Then we can have more severe form in the form of fever, which is high grade, body ache, congestion, sore throat, coughing, and finally, in a few cases, it will develop into a frank pneumonia, which can be very, very difficult to treat, and there could be an acute respiratory failure. What is important to understand that over 80 to 90% of all individuals who actually have this coronavirus, the novel coronavirus, will be able to take care of it and will not have a problem. But that 10 to 20% can have a significant problem, and that is what we are all worried about. The other thing to worry about is that people may actually have the virus and they may have no symptoms, and therefore they may be missed in the initial phase and they may spread the virus across. So none of us across any ages, across any strata, across any socioeconomic strata are immune to this disorder, and we are going to be exposed to this significantly. Now the big question that comes to our mind is this: how does this interaction between COVID-19 and diabetes takes place? And we all hear reports that individuals who have diabetes have a much worse outcome as far as COVID-19 is concerned. One of the reasons, of course, is that many of the diabetes patients have reduced immunity, so they are not able to ward it off, and the same infection is able to spread much wider in these individuals, and they tend to become more severely infected. Moreover, these infections tend to spread more, causing lung infections requiring the need for ICU. So as a general rule, somebody who has got diabetes and has got this COVID-19 would be worse off than somebody who does not have diabetes. But does it mean that our children and adolescents with type 1 diabetes are at a very high risk for this disease, and what do we do from there? The most reassuring finding which we can share based upon the data which is available is that children, as a rule, are very less likely to be infected with this infection, and even if they are infected, the chance of it progressing to a serious disease is less. So if you look from this figure from China, what they're saying is the risk of mortality in the first 9 years was actually 0%, and between 10 to 18 years was only 0.2%. So as a group, children and adolescents below 18 years of age have a very low risk of having severe infections, and similar findings have been observed from the American study, where 0 to 9% actually account for very limited amount of hospitalization. Only 1.6% were hospitalized and none of them required ICU care. So the reassuring part is that children and adolescents with diabetes will not have any predisposition probably at the moment with regards to increased risk of severe disease. That does not mean that this will be a universal truth and that anybody can become sick, because there are reports that younger individuals may have an infection. We need to be careful. But one thing which is reassuring is that probably at the moment there is no evidence to suggest a more severe outcome of somebody who has type 1 diabetes with COVID-19. But that is definitely not the end of the story, because there are so many other issues that we have to talk about in terms of the daily lives of children with diabetes in the times of this COVID-19 pandemic. We'll basically focus upon three aspects: prevention, how to do if somebody becomes sick, and what to do about practical issues in terms of when many of us are in lockdown, in terms of availability of resources, how to use it, and what if something is not available to us. Now, prevention, of course, is the most important thing, and we have all heard about how it's like a viral illness. So we have heard so much about how a video becomes viral, how a particular song becomes viral, but this is a classic situation of a virus becoming viral. So when we have a viral infection for which there is no immunity, the infection will keep on spreading, and from 1 to 10, 10 to 100,000. But we can take care of it by really preventing it, by not spreading from one person to the other. And if we block the chain, we can actually flatten the curve. And this is something which is extremely important to understand, that if we just take basic precautions and be serious about a lot of these illnesses, we can flatten the curve and not result in a significant impact on our healthcare system. And how can we do that? We all know about that. It is through social distancing, maintaining a difference of between 1 meter, even within your family members. We all develop our own cocoons in which we live, and even if we are in a public place, we follow that. Second most important aspect is, of course, hygiene and hand washing. One message I like to give is that there is no role of sanitizers to be used frequently all the time. Soap and water are good enough. What you need to do is a minimum 20-second hand wash, and we need to cover each and every aspect of the hand. When we talk about a hand wash, it's not just rubbing around in your palms. You have to actually take care of some things between your fingers, between your thumbs, and all the aspects have to be taken care of. And as discussed, a good bactericidal soap is good enough. If you want to use a sterilizer or a sanitizer, something which has got alcohol content more than 60 to 70% would be what is required. But in most cases, soap is good enough. Another question which a lot of us are asked about is that what to do, because our kids have never been in home for so long time. They are always playing, they're watching videos, they're just not doing anything physically active, and won't that make their diabetes more difficult? Of course, we need to do something innovative. We need to play with them. We need to engage on activities which makes them happy as well as physically active. So we should take them off from the screens, the mobiles, and push them towards a more active life, and that's very, very important. Now, having talked about prevention, the next issue, of course, is what to do if somebody develops an infection. Now, as we discussed, the chances of infection to become severe would be less likely in children and adolescents as such, but that infection itself can cause a lot of problems, because even minor illnesses can have a huge impact in diabetes. It's very well known that if somebody develops a fever, there is a release of stress hormones which basically cause insulin resistance, resulting in increase in glucose and production of ketones. And it is these ketones which are really dangerous for our body. Now, if somebody is actually developing loose motions, there would be, or vomiting, there will be hypoglycemia, and that will again result in development of ketones. So there is also a compound issue of insulin resistance resulting in dehydration. So sick day In any form of diabetes associated with both high and low blood sugar, possibility of development of diabetic ketoacidosis, and one big message is not to stop insulin. Now, in this context, we have to be careful in terms of management in children with type 1 diabetes and COVID infections as well. So, how do you manage these children? Not very difficult, very simple rules. Ensure that the fever doesn't go high so that these counter-regulatory hormones don't go high. We give more water to avoid dehydration. Give more insulin because the insulin is not working well. And always measure glucose and measure ketones. If we are proactive, even if children have got high-grade fever, there should not be a problem. The main concern that we have is that we are not controlling it properly. There will be a risk of low sugars or high sugars causing diabetic ketoacidosis. So preventive measures basically are never to stop insulin, increase the dose if the fever is there. If somebody has diarrhea or vomiting, you can decrease the dose, but do measure blood sugars 4 hourly. Try to maintain them between 100 to 180 milligrams per dl and measure ketones 6 hourly. If you do not have a blood ketone strip, don't bother. You can use a urine ketone strip which will give you a reasonable idea. Always give a good amount of fluid, and if somebody has a sugar which is lower than 100, give them a sugary fluid. Very important to reduce fever, to stop vomiting with medicines, and give lots of fluids. So key message, allow them to have something to eat, reduce fever, reduce vomiting, lots of food, and measure blood sugar and ketone. Now, how do you react based upon the sugar and ketones? If anybody has got a ketone which is more than 3 on a blood meter, or a urine ketone which is more than 3 or 4 plus, requires hospitalization. On the other hand, if the sugar is less than 100 and ketones are less than 0.6, you can just monitor the child, give them more sugary drinks, that should be it. But if it's between 0.6 to 3, we need to give more fluid and carbohydrate intake. If the sugars are in the normal range, the target we talked about 100 to 180, and the ketones are less than 0.6, again monitor. Ketones are between 0.6 to 1.5, we have to give fluid and carbohydrate. Between 1.6 and 2.9, we have to give insulin, which is 5% of the total daily dose. So what you do is that you add up the entire total daily dose. If somebody is on, let's say, 10 units of glargine and 555 of Lispro, he is on 25 units. And then you make 5% of that 25 unit, and then you will get the extra dose that we are talking about. Now, if somebody is having high sugars, 180 and 400, and ketones is less than 0.6, or it's no ketonuria, you give 5% extra insulin. If it's 0.6 to 1.5, that's around trace to 1 to 2 plus, give 5 to 10%. If it's more than 1.6 to 3, which is like 2 to 3 plus, give 10 to 20%. And of course, if it's more than 3 millimoles per liter or 3 to 4 plus, you have to hospitalize that patient. If the sugars are more than 400 and the ketones are still less, you have to give 10% of the daily dose, and we'll discuss is using a case as to how do we really use it practically. If it's between 0.6 to 3, you give 10 to 20% insulin, and of course if it's more than 3, you have to hospitalize. So very important when you are monitoring and managing this child is to measure their sugars and ketones and take action appropriately. Hospitalization is indicated if somebody is having recurrent vomiting, abdominal pain, or a high ketone level. Now, just to highlight a few cases, we have a 3-year-old boy with vomiting, and this is the protocol we talked about. We check the blood sugar, it's low. So he's actually in the hypoglycemic range, less than 100. We look at ketones. Ketones are 1.2. So this indicates that we need to give carbohydrate and fluid, reduce insulin, give him a sugary drink, maybe orange juice or something like that. Give him fluids, measure sugar ketones frequently. 11-year-old girl with fever, and this is our protocol again, just for reference sake. We check the blood sugar is slightly high, 240. So what you do in there, look at ketones. Ketones are 0.4, so ketones are negative. So this child has high sugars, but ketones have not developed. So he is actually now on 50 units of insulin, 20 of glargine, which is the long-acting, and 30 of Lispro, which is short-acting. So what we need to give is 5% of extra total daily dose. So this in this case becomes like 3 units because it's 50 into 5% becomes 2.5 units. So we give 3 units of Lispro and then we keep on checking the blood sugar. 10-year-old boy who has now developed high-grade fever. This is our protocol. Blood sugar is 300, so it's reasonably high. His ketones is 3.2. As I said, if ketones are more than 3, don't do anything else, rush to the hospital. And that's very important because this child may actually be in diabetic ketoacidosis. So very important when the child is having fever is to check for blood sugar, check for blood or urine ketones, continue fluids, continue insulin, reduce temperature, reduce vomiting, avoid dehydration, and that will be good in that perspective. So we've discussed about how to prevent, how to actually act when there is an illness. The next issue is some of the practical issues that we are facing. One problem, of course, is with insulin. So I would advise all of you to keep at least 2 months stock of insulin. If insulin is not available, the RSSDI, which is the Diabetes Society of India, has actually provided an emergency helpline of different companies which provide insulin. You can directly be in touch with these individuals and they would be able to help you out in terms of supply of insulin. This is very, very important. So keep note of these numbers and try to contact them as required. So I recently had a call a couple of days ago of a 12-year-old boy with type 1 diabetes, 2 years. He was doing pretty well on Glargine 12 and Lispro 444. So a total dose of 24 units. He actually lives in a remote area of Uttar Pradesh where he is now not getting the Lispro insulin. So of course we can try some of these helplines which may be able to provide us, but sometimes it may be very, very difficult in remote areas. He actually has a premixed form of insulin and the question is what to do. So when we are in a desperate situation, we should take desperate measures. So it's very essential that this child should receive some insulin rather than not giving, thinking that this is not the right insulin. So what we would do is that we will switch over to premix, and what we need to do is to keep the same total daily dose. So he is on 12 plus 4 plus 4 plus 4, which is 24 units. 2/3 to be given before breakfast, 16 units and 8 units at dinner. So basically, till the time he is able to get the short-acting insulin, we can use a premixed insulin to get a good result out there. Now, another problem which we are facing is insulin pump and availability of disposables and other aspects because of supply chain issue. So while insulin pump is very good, it's very effective, but if it's not available, if you don't have the disposables available, if you don't have the tubings available, it is always very, very important to keep insulin pen as a backup. So if it's not available, don't worry, you can always switch to pump pen. And when the things become better, the availability becomes better, you can go back to the insulin pump in that regards. 15-year-old boy, type 1 diabetes, 5 years duration on an insulin pump, total daily dose is 42 units. Pump supply is now expiring. He just gave me a call yesterday. He already had insulin available locally. So what we said, don't worry, switch over to a basal bolus. So we kept the same total daily dose of 42 units. Basal as 50%, that is 21, and bolus as 777. So this is something which we can do practically. All of you would have contacts with your doctors. Please contact them. They will be able to help you out, and this could be something which can be helpful. But the key message here is that if you do not have the insulin you're using, but some other insulin is there, as a desperate measure, you can change it. If you are on pump, be very, very careful that you actually use pens if pump is not working. So the way forward from here has to be an international global cooperation, and I'm sure that with all that we will be able to beat this real pandemic which has to go from the face of earth. I'd like to thank Dr. Rajesh for inviting me for this opportunity, and through his wonderful work that they are doing, their Doctors.co.in platform to make doctors and general public aware about these measures. You can visit our YouTube channel or the Grow India website, learning.growsociety.in, to get more information about these health related issues. Thanks a lot.